When you ask your team to hand over AHPRA registrations and police checks, you're gathering some of their most sensitive personal information. Putting all those files into one digital system makes practice management much easier, but it also creates a single, highly sensitive target. If you're managing a practice, you can't just take a software company's word that they are secure. You have to verify it. The first thing you need to figure out is geography. Where exactly do those files physically live? And who possesses the technical authority to actually view those files? A feature list won't answer those questions. To know if a platform is actually safe for your team's data, you have to look at how it's built from the ground up. For Australian healthcare teams, the baseline rule is simple. The data has to stay in Australia. This map shows our hosting setup. Everything is locked strictly to the AWS AP Southeast 2 region, right here in Sydney. Sending staff compliance data offshore for cheaper processing violates local compliance standards, so we never do it. Every document and backup sits in private storage, fully encrypted at rest. There are no public file links. If a system uses URLs that anyone can guess, automated bots can scrape your files. We eliminate that risk by keeping the storage environment completely closed off from the public web. Platforms that save money by bouncing data through international servers introduce countless points where that information could be intercepted. Keeping all data and processing onshore requires strict engineering discipline, but it's the only way to maintain total control. By enforcing hard physical boundaries and strong encryption, you shrink the number of ways data can be exposed down to near zero. When you use cloud software, your practice is sharing infrastructure with hundreds of other clinics. The invisible danger there is cross-contamination. To protect your team, the database has to guarantee that your practice is entirely walled off from the rest. In the back end, every request for information must include your specific organization ID to proceed. Automated tests run on every software release to verify this boundary. These tests mathematically confirm Practice A can never, under any circumstances, pull up staff records for Practice B. When you rely on shared infrastructure, strictly enforcing data isolation at the code level is the only way to ensure independent confidentiality. External threats are only half the equation. You also have to control who inside your practice can see these files. Managers sign in with full authentication through AWS Cognito. Staff act through secure, time-limited links tied to one person for one purpose. When uploading sensitive documents, they enter a one-time passcode sent directly to their phone. Typing in a code adds a few seconds of friction to the process. That minor hurdle guarantees nobody else is opening that link. By separating access methods based on a person's role, you ensure staff can only see their own tasks and never files above their clearance level. Even with strict access controls, you still need a perfect record of exactly who is interacting with your team's files. In this append-only audit trail, new rows are added to the bottom. When activity occurs, the system writes a permanent log entry. Once written, it is locked. No user can edit or delete an entry, keeping data safely out of reach from manual editing. If you ever face an inquiry, an unalterable history is the only way to definitively prove who did what and exactly when it happened. There is a strict boundary between managing employment compliance and managing patient health records. PracticeCentred is for staff operations only. You should never upload patient names, clinical notes, or Medicare numbers. Mixing human resources files with protected health information creates severe legal and structural vulnerabilities for your clinic. Enforcing this rule means your management team needs to stay vigilant about what staff are submitting. If a team member accidentally uploads patient information, you can flag it directly in the platform. The file is securely destroyed and the removal is logged. Refusing to store clinical data in the first place is simply the most effective way to protect your practice from a patient privacy breach. This scorecard reflects our internal corporate policies. We built this platform with rules specifically designed to prevent data exploitation. We don't sell your compliance data, and we never use your staff's information to serve advertising. The platform is engineered to be a secure background utility that does its job and gets out of the way, rather than an application trying to drive daily engagement. To keep things running, security techs always deliver, even if your SMS credit balance hits zero. Verification should never be blocked by a billing issue. Automated emails and texts are restricted entirely to the service notifications that you have actively configured. These fixed boundaries ensure that ultimate control over privacy and communication stays exactly where it belongs, with the practice owner. Protecting your team's sensitive compliance records requires looking past the interface to verify the architecture underneath. You can review our complete technical specifications and security protocols at practicecentre.com.au/security. Take the time to evaluate those structural details. Once you're confident in the system's integrity, you can start your 30-day free trial.